Hi everyone, welcome to my channel. In this video, I'll be saying about the attachment and the clinical of the radius bone. So let's start with the insertion. So in the radial tuberosity, let's start with the radial tuberosity. The radial tuberosity, the anterior part of the radial tuberosity is covered by bursa, but the posterior rough part is there is a presence of a muscle, that is the biceps brachii muscle insertion is there. Okay, now the supinator muscle. Supinator muscle is present in the lateral surface. So this is your lateral surface. Okay, in the upper part you will get the supinator muscle, upper part. Okay, pronator teres muscle you will get in the middle part, middle surface of the lateral lateral surface. Okay, and then the brachioradialis muscle will get in the lower part of the lateral surface above the styloid process. So there are three muscle attachment in the lateral surface. First is the above there is a supinator muscle, then in the middle there is a pronator teres, and at the end there is a brachioradialis muscle. Now pronator quadratus muscle. Pronator quadratus muscle is present in the lower part of the anterior surface and the triangular area in the middle surface of the lower end. So this is the this is the lower part of the anterior surface. So here you will get the pronator quadratus, and in the medial surface, see, this is the medial surface and this is the triangular portion of the medial surface. So here, from here to here, you will get the attachment of the pronator quadratus muscle, and you can palpate the radial artery against this muscle. Okay, now let's move into the origin of the muscles. So first muscles we have the flexor digitorum superficialis, which origin from the anterior oblique muscle or anterior oblique line, sorry. So this is the anterior oblique line. So from here you will get the flexor digitorum superficialis. Okay, now flexor pollicis longus is present in the upper 2/3 of the anterior surface. So this is upper 2/3, full anterior surface 2/3, it will be pronator flexor pollicis longus. Now we have abductor pollicis longus or extensor pollicis brevis. It is present in the posterior surface. So for that you will have to move in the posterior surface. In the posterior surface, how you will understand? By the dorsal tubercle of the ligature. Okay, so this is the posterior surface. Here the abductor pollicis longus and the extensor pollicis brevis is present. So above the abductor pollicis longus is present and below the extensor pollicis brevis is present. Okay, so the important topic is now this attachment of these groups. These four groups here which you are getting. So the attachment of these groups. First one, the first group you have between the styloid process. Between the crest like lower part of the anterior border. So this is the anterior border. So this is the lower part of the anterior border and the styloid process. So this is your first group. Here you will get the origin of the muscle of the abductor pollicis longus and the extensor pollicis brevis. Okay, now second group we have between the styloid process and the dorsal tubercle of ligature. This group, okay, this group gives the origin of the extensor carpi radialis longus and the brevis tendon. Now third group, so this is the third group, medial to the dorsal tubercle of ligature. So this is the dorsal tubercle of ligature. So medial to it, this is the third group. So here you will get the passing of the extensor pollicis longus tendon. Now the fourth group is between the in the medial aspect. Okay, here you will get the tendon of the extensor digitorum, extensor indicis, posterior interosseous nerve and the anterior interosseous nerve. Posterior interosseous nerve and the anterior interosseous artery. Okay, one nerve and one artery. Okay, now these are the attachment of the groups, the four group. Now in addition there are fifth and the sixth group also. So for the fifth and the sixth group you have to attach the ulna here. This is the opposite side ulna, so sorry for that. Just for the understanding, if you attach the ulna in the inferior radio ulnar joint or the ulnar notch here, then you will get a fifth group, and fifth group is between the lower end of the radius and the ulna. Okay, here, and it gives attachment to it gives the passes of the tendon of the extensor digiti minimi. Okay, now the sixth group, okay, you will get in between the head of the ulna. So this is the head of the ulna, you know, in the lower part, and this is the styloid process of the ulna. So here between these two means here you will get the attachment of the tendon, that is extensor, CARPI, ULNARIS. Okay, you will get it here. So this 4 groove or 6 groove attachment you have to know, and the tendon which is passing, tendon, nerve, and the artery which is passing through it. You have to know this. Okay, now let's move into the ligaments. So you know there will be ligaments present. Now first we have the quadrate ligament. Quadrate ligament is present in the medial part of the neck. So this is the neck and this is the medial part of the neck. So here you will get the quadrator ligament, quadrate ligament. Now articular capsules of the wrist joint. So the wrist joint will be formed by this lunate bone and the wrist bone. Okay, from with the radius. So there will be articular capsules of the wrist joint which is present in the anterior and the posterior margin of the inferior articular surface here. Okay, where the wrist bone will be joined here. And the articular disc will be present in the inferior radioulnar joint. So this is the inferior radioulnar joint. If you attach here, so this will cause the inferior radioulnar joint. It is present in the ulnar notch. Okay, here in the ulnar notch it will be present the articular disc. Now the interosseous membrane. Interosseous membrane, see, as you know, this radius is the lateral bone. Okay, so interosseous membrane will be present between the radius and ulna. So it will be present in the medial border. So this is the medial border. So interosseous membrane you will get in the interosseous or the medial border and the lower 3/4 part. Okay, here lower 3/4 part you will get in attachment of the interosseous membrane. Extensor retinaculum is present in the lower part, lowest part and the sharp anterior border. See, in the anterior border you will get in the lowest part you will get the extensor retinaculum. Okay, so this all are the attachments with origin, insertion and the ligaments. Now the clinicals. First we have the Colles fracture. Colles fracture means in the radius the common part of the fracture is 2 cm above its lower end. Okay, is known as the Colles fracture. So Colles fracture occur caused by the fall on the outstretched hand. Means if you fall with your outstretched hand. So effect is that distal fragments gets displaced upward and backward and the radial styloid process. So this is the radial styloid process. This comes proximal to the ulnar styloid process. Okay, then this is the radial styloid process and this is the ulnar styloid process. This radial styloid process comes proximal to the ulnar styloid process. Now the second is the pulled elbow. Pulled elbow you see usually in the children. Okay, so pulled elbow is a sudden powerful jerk on the hand of the children may dislodge the head of the radius. Okay, if you pull the hand of a baby, then what will happen? This head gets dislodged, okay, or displaced from its annular ligament. Now the head can be felt in the hollow behind the lateral epicondyle of the humerus. You can feel this elbow against the lateral epicondyle if you touch it. Okay, so this both are the clinical, that is Colles fracture and the pulled elbow. Now the important questions for the viva your examiner or your external may ask. First is the insertion of the biceps brachii muscle. Where are the insertion of the biceps brachii muscle? Now second, they will ask about the radial pulse. Where you will get the radial pulse? You know it here in the radial fossa. Then next they will ask the Colles fracture and the pulled elbow. Next the carpal bone. What are the carpal bones is related with the radius. And the attachment in the anterior surface. What are the attachment in the anterior surface? And last but not the least, the important one, this grooves attachment or the tendon or artery or nerves which pass by these grooves. These all are important and they will tell you to mark the 4 grooves. Okay, that's all. Please do like, share and subscribe to my channel. Thank you so much.